Hello, my name is Jamie Guo, and this is my journal club presentation on the study titled Reliability of Surface EMG Measurements for Trunk Muscles During Lifting Variable Loads in Healthy Subjects. So, the purpose of this study was to evaluate the reliability of surface EMG measurements for trunk muscles during lifting tasks with variable loads. Specifically, the study aimed to assess the reliability of the similarity index SI value, the magnitude and the timing of muscle activation. Why this study is significant: understanding the reliability of SEMG measurements is crucial for assessing muscle activation patterns during different lifting tasks. The information and results that we acquire can be used in rehabilitation, ergonomic design, and injury prevention strategies. So some of the research questions that the study deemed to answer was: how reliable were SEMG measurements for trunk muscles during lifting tasks with variable loads? Is the similarity index a more reliable measure compared to the magnitude and timing of muscle activation? And lastly, can SEMG be used to assess motor control during functional tasks? So for the literature evaluation, over 30 research articles were referenced in this paper. All the articles referenced focused mainly on SEMG reliability, trunk muscle activation, and lifting biomechanics. All the citations were thorough and directly related to the research questions. So for the subject of this study, seven male, seven healthy male subjects with no history of trunk injuries or musculoskeletal disorders or lower back pain for at least 6 months were selected. The age ranged anywhere from 20 to 30 years old, and they all had a collective BMI value less than 28 kilograms per meter squared. So, for the inclusion in this subject, no history of musculoskeletal or neurological disorders were included, and also no recent injury affecting the trunk or lower back was included. Some of the exclusions that I noticed throughout the study is that they never asked about histories of respiratory or cardiovascular disorders, which could potentially affect the study and the reliability. So for the sample representative, the sample size was very small, only being 7 subjects, which may limit the generalizability to other patients or populations, specifically females and those individuals with skeletal musculoskeletal disorders. When I was reading the research paper, no evidence selection bias was reported, and then all participants were provided informed consent, and the study was approved by the IRB. So for the methods and design, the study design was that the participants were to perform lifting tasks with variable loads, being 5.5 kilograms, 7.5 kilograms, 9.5 kilograms, and 12.5 kilograms respectively, while surface EMG measurements were recorded from the trunk muscles, basically saying the lower back and the front abdomen, and each participant completed multiple trials per loading condition. So for the procedures, the first participant stood in a standardized position. The lifting tasks were performed using a standard box lifting protocol. Surface EMG electrodes were placed in the trunk muscles according to the SENIAM guidelines. And lastly, data were collected during the lifting phase of each trial. So for the data acquisition, like I said before, the surface EMG signals were recorded using an 8-channel portable EMG system. The raw EMG data was filtered using a bandpass ranging from 10 to 500 hertz, and this was processed to calculate the muscle activation levels. Intra-task correlation coefficient, the ICC, was also used to assess reliability across trials. And as stated before, there was ethical considerations as the patient's rights were protected through the informed consent and the IRB. So here are some of the pictures provided. This is a picture of the EMG locations on the lower back. This is a picture of the EMG locations on the front abdomen. And this is a slight screenshot of the standard box lifting protocol, which is very similar to a deadlift if anyone has done that. So for the data analysis, the normality of data was assessed using the Shapiro-Wilk test, and the reliability of the surface EMG measurements was evaluated using an ICC for consistency across trials. Repeated measure ANOVA was also used to compare muscle activation levels across loading conditions. And for our case, a P-value of less than 0.05 was considered significant. So I think that the tests were very appropriate for this as the goal was to assess reliability when comparing muscle activation across different conditions. The use of ICC and Pearson correlation coefficients also provided robust measurements for reliability. So for the results, the surface EMG showed very high reliability of an ICC value greater than 0.75 across all loading conditions. The similarity index also showed a perfect within day reliability of an ICC value within 0.73 and 0.97. Showing this result showed that the SCMG was very reliable when measuring muscle activation. So for the muscle activation, increased significantly with higher loads of a p-value less than 0.001, indicating really high significance. The erector spinella showed greater activation compared to the rectus abdominis during the lifting tasks, meaning the lower back exerted more force compared to the from abdomen. And lastly, the timing of the muscle activation showed the least reliability, particularly in the abdominal muscles. So some of the findings from the study demonstrated high reliability of surface EMG measurements for trunk muscles during lifting tasks with variable loads, which answered our research question. And muscle activation patterns were consistent across trials, indicating robust SCMG data collection methods. So some of the limitations that I found in the study were that the study was limited to healthy male subjects, so results might not be generalized to females and individuals with musculoskeletal disorders, as I mentioned before. The lifting protocol was also very standardized, which may not fully represent a real world lifting scenario, as rarely we will be lifting heavy objects in a standardized box lifting procedure. And lastly, as mentioned before, the small sample size of 7 subjects really limits the generalizability of the findings again. And some of the interpretations that I found. So the findings suggest that the surface EMG is a reliable tool for assessing trunk muscle activation during lifting tasks, particularly when using similarity index. And the results support the use of surface EMG in ergonomic and rehabilitation settings, especially for evaluating motor controls during dynamic tasks. So the significance of this study, there's many implications on what this study entails. The study contributes to the understanding of surface EMG reliability and assessing trunk muscle activation during lifting tasks, as this was the main research question I was trying to answer. Findings can inform ergonomic guidelines and rehabilitation protocols for lifting tasks, particularly in occupational settings. The replicability of this study is very easy with similar equipment and protocols, but future studies should include a larger and more diverse sample. So some additional questions I have for this study is, how does SCMG reliability vary in populations with people of musculoskeletal disorders? And can surface EMG measurements be used to predict injury risks during lifting tasks? And what is the impact of fatigue on surface EMG reliability during prolonged lifting tasks? Thank you.